Why might my A1 degrees Celsius diabetes test results be inaccurate? Imagine checking your blood sugar levels and getting a result that doesn't quite match how you feel or what your other tests show. That can be confusing, right? The A1 degrees Celsius test is a handy tool because it shows your average blood sugar over the past 2 to 3 months by measuring how much glucose is attached to hemoglobin in your red blood cells. But sometimes, the results can be off. Several things can cause this, and knowing about them can help you understand your numbers better. First, think about your red blood cells. They usually live about 120 days, but if something changes that, your A1 degrees Celsius might not be accurate. For example, if you have recent blood loss or if your red blood cells break down faster because of hemolysis, your A1 degrees Celsius could be falsely low. On the other hand, if you have iron deficiency anemia, your red blood cells tend to be older and may have more glucose attached, making your A1 degrees Celsius look higher than it really is. Conditions like kidney failure or liver disease can also affect how quickly your red blood cells turn over, which can throw off your results. Next, some people have inherited differences in their hemoglobin, the protein in red blood cells that carries oxygen. These are called hemoglobin variants, like hemoglobin S, C, D, or E. They are more common in people from African, Mediterranean, or Southeast Asian backgrounds. These variants can interfere with the test, causing it to overestimate or underestimate your true blood sugar levels. That's why some labs use special tests designed to work better with these variants. Certain health conditions also play a role. Diseases like sickle cell anemia or thalassemia change the structure or lifespan of red blood cells, which can make the A1 degrees Celsius results unreliable. Infections, chronic anemia, or treatments like dialysis and medications that stimulate red blood cell production can also cause misleading results. It's also important to remember that A1 degrees Celsius levels don't always match blood sugar readings equally across different ethnic groups. For example, some studies show that African American individuals tend to have higher A1 degrees Celsius levels than expected based on their blood glucose, possibly due to genetic factors. Other factors can influence your results too. Pregnancy changes how your red blood cells are replaced, which can affect the A1 degrees Celsius. Smoking and certain medications like steroids can temporarily raise blood sugar or interfere with the test. Sometimes, lab errors during sample collection or processing can lead to inaccurate numbers. Knowing all this, your healthcare provider might suggest other tests or different types of A1 degrees Celsius assays if they suspect your results aren't accurate. They might also compare your A1 degrees Celsius with blood glucose measurements taken at different times. Being aware of these factors helps you and your doctor make better decisions about managing your diabetes. If your A1 degrees Celsius doesn't seem to match how you feel or other tests, don't hesitate to ask your healthcare provider about what might be causing the discrepancy and what other options are available.